Swayam Prabha. Digital India. Educated India.
Welcome to NPTEL MOOC platform. This is the course on health economics, which is rarely discussed in NPTEL platform. We have structured the health economics course into 12 weeks, as I already mentioned. Each of the contents are actually covering different perspective of healthcare. That is covering finance in healthcare, then insurance, behavioral issues, health systems, then demand and supply, which are the basic stuffs we will be covering. In addition to that, we will also discuss on the data sets which are largely used in health economics. Then we will be covering micro aspects as well as macro aspects. In addition to that, there are important dimensions and applications of health economics which are also covered at the later part of our module. I am quite sure that which we have already mentioned in the very introductory lecture is going to help you a lot if you attend till the end of the sessions. In this particular lecture, we have included as part of the introduction module, health as an economic good. We all know that different goods and services are defined, and its economics of these goods and services are actually conceptualized differently. But health as an economic good is actually not well defined in different literatures except some particular readings. Therefore, clarifying health as a commodity or health as a service or health care as a service unit is quite interesting to note. So, in this case we will clarify to what extent economics of goods and services are attached, especially health as an economic good. So, accordingly we have defined the couple of points which are covered in this lecture. They are understanding health as an economic good, then we will also address fundamentals of economics, role of economic agents, then we will also discuss about the healthcare market, the relevant factors that those are important for health and healthcare as economic good are also important. Some other points are also connecting to these factors, then it's the fundamentals of economic good are actually implications of healthcare being an economic good. And in the understanding, we would also clarify which are the core fundamental aspects of economics. Also, we will emphasize the agents or the institutions which are responsible for defining these an economic good. In addition to that, we will be also discussing on challenges of treating healthcare as an economic good. Last but not the least in the content is on deciding who gets what in healthcare. So, let us discuss about health as economic good. We start with the views of different economists. They treat health and healthcare as any other good and call it as an economic good. Economic goods are defined as any goods or services that are actually scarce relative to the society's wants for them. As we all know that any goods and services considered to be valuable if the demand and supply mismatches, and basically when the supply of it is scarce as compared to the demand. Therefore, the economic agents or the consumers or of the commodities and services, if they find the commodities to be scarce, usually certain valuations are made. Morris in 2012 discussed economics goods very clearly. And we have also cited that book at the end of our lecture. You can follow it. And then we will also discuss about what makes healthcare actually an economic good. To answer this particular question, one requires to have an understanding of the fundamental concepts of economics. We have clearly highlighted different types of economic goods. We also highlighted which are the agents, how they are defining economic goods differently. Starting with economics is a social and science subject. We start with social. When we say it is social, in that case actually we are dealing with the societal issues which are to a large extent define the resources to be scarce, and when we are defining it as a science, we will obviously attach the decisions with it, will obviously attach the behavior of economic agents and some extent of predictions through the interaction of the different agents with their behavioral frameworks. So, in all both the context, social, whether it is or in scientific context, we will clarify the resources as against their bounded or unbounded constraints. Whenever we say constraints, that means we are discussing about bounded availability or availability which is clearly bounded. So, given the constraints, we need to allocate the resources very carefully. This is what is clearly emphasized. So, economics is said to come into play whenever and wherever there are two key features arising within a nation or an economy. So, broadly we are discussing about resources that are limited and the potential users or the potential uses of those resources which are unbounded. The unbounded resources has to be properly allocated and utilized. This is what in short is discussed as part of economics of any goods and services, especially in healthcare, health and healthcare. Now, so far as understanding economic good is concerned, health as economic good is concerned, we are supposed to discuss the important agents who are responsible for actually defining this as an economic good. Especially we start with people, persons, largely they are accounted for the demanders or the demand patterns. Even firms and other government and organizations are also part of the forming the demand. We will also discuss all sort of things and how they interact each other as an economic agent to define the value of the product. We are emphasizing here. Broadly, these three agents are discussed in two contexts: buyers or sellers, buyers or consumers, or they are also called demanders, and the other agents are called sellers or producers or suppliers. Now, the role of reverser also matters. They can be also demanded. Those are sellers. They also demand, potential demanders for the products as well at different period of time. So, it calls for interaction. To what extent there occurs a circular flow from demanders to the sellers or the sellers to the demanders. We usually study these in our foundation course of economics, introductory economics courses, but even if you haven't read it, it is perfectly fine. You can easily understand that a seller can be also a potential consumer. Seller is a person who is selling product, is also simultaneously contributing to demand. Okay. So, they are also part of the market, and there occurs a circular flow, like demanders demand the products of the sellers, and sellers provide the or make the products available to the buyers. Therefore, a strong interaction forms the market. Now, don't you think that this market is purely functional just by this interaction? Do you think that this is just randomly or eventually occurring? It is actually not. Why am I emphasizing this? because though we have defined different agents, they interact each other, and it is quite obvious that since the interaction is to a great extent bargaining their contracts, bargaining their share in different contexts, they will obviously raise a possibility of conflicts. Therefore, the market is a place where it resolves different forms of conflicts. So, we will come across those conflicts through different agents and their interaction in our successive discussions. To answer these questions, we need to address some of the very fundamental questions like why, where, whom or how these agents interact. So, starting with why those agents actually interact, we start with some of the basic assumptions of economics or the agents as part of the market or the function of the market. They are considered to be rational. First one is they are considered to be rational, whether the person or the agent is individual or firm or organizations. So, rational, what do you mean by rational? The choice function they express, they exhibit is considered to be rational. It should not be irrationally defined. Okay? Like we simply say a choice function of mine to demand or consume something while in the moon, okay? Or if we simply say some of the examples like while man is flying and therefore man can catch different forms of avenues in the air, that is a completely irrational assumption. So, we need to be very rationally defining our choice functions, like some irrational choices like some of the goods are not called economic good. And the choice function, for example, in microeconomics we used to explain that the consumer has to express correctly, like again if I say a consumer is expressing clearly with A over B, commodity basket A over B, and consumer should also be given a choice functions to prefer B over A. So, what does this mean? This means that consumer should not be completely restricted in its choice function. And rationality in simple form we say that when a consumer is like I am a kid in a family or a child in a family, my parents have given certain amount to me, to spend in the market. But first assumption in that case is that the parents have suggested me to go for purchase of different commodities, not just be biased to one commodity. Okay. In that case, what really happened, as a child in a family, I may be biased because I may not be a complete rational consumer. What I'll do, I will simply arrive in the market and start purchasing only one variety of commodities which I actually like. Okay. So, like when I want only one variety and I have purchased everything of that variety by spending the entire amount, in that case the first assumption is not rational. The rational is that the consumer must distribute and allocate the resources sufficiently. Okay. So, some example I have already given, and some in microeconomic context I have said that consumer has to allocate rationally the amount that has to be spent. Then another reason behind the agents to interact each other is called is through reasoning, like which we say, we start with saying that economics works on a very basic assumption of rationality. In other words, everything happens for a reason, okay, which means every action an economic agent takes has a strong reason. So, reason has to be specified. Now, when I say let us start with one example in this case to suffice the interaction of the agents very clearly, whether it is rationality or with a strong reasoning or not. We say that suppose consumer want or the individual wants something, maybe a product, maybe a service. So, we have also highlighted in this picture, consumer wants something, maybe a product or a service, And now we are saying there is someone else who has that product, or there is a provider who is actually providing that product which the first individual is demanding. And how is it possible? And this is possible with the help of some exchange. If you remember, in the earlier system it used to be barter system based, goods are exchanged with goods, but in the in the present format, in the international level, the medium of exchange is money or the currency. So, currency forms the value of transaction between two parties. So, that way we can say that the consumer is actually going to get that product with the exchange of some another product or through money. Okay. So, to satisfy each other wants, they will have to interact. The first basis of interaction we just say is through of course through a certain rationale of choices, then certainly through certain reason, why do I want this and who else are actually there to fulfill my wants. So, in that case interaction forms the relations between these two parties. So, interaction is emphasized in this diagram. We will also discuss the interaction is of course through certain places, certain marketplaces, and we will emphasize where they are actually going to interact. In reality, there are a lot of such individuals or firms who interact in order to meet their demand and supply in their day to day spending or day to day behavior. The economic name of this place of interaction is actually called market. So, as I already mentioned that market is a place where these two party as a demander or as a supplier are actually interacting, that is simply called market. In healthcare also we need to take the help of a market. Now, in other chapters we have certain sections which will be discussing about some forms of regulations about market, what should be an ideal market, okay, to what extent market is actually regulated. We will be emphasizing through public policies in any healthcare products. Okay. Now, markets can be further divided into three types. One is called capitalist market, that's also called free forms of market. Another form is called socialist or welfareist market, and the mix of these two is actually called mixed market. Now, you just imagine where these forms of markets are available. If I just cite it from now and start with Indian context and compare with the developing countries and developed countries context, what Indian market really wants, especially for its healthcare needs, and what the developed countries really need to provide to their consumers or to their patients in terms of healthcare goods, okay, or healthcare services. In that case, the different types of markets can easily be understood. So, to clarify clearly, in Indian context we know that number of things are challenging, especially if you look at doctor patient ratio as per WTO standards is still far from reach. We are not still reach as per the standard. We will explain this in our other slides. And similarly, the quality of healthcare. So, in that context we will emphasize what is called health and healthcare. So, the service quality etc. are actually not that good in terms of some standard made by our topmost institutions like WHO. And if you also count certain indicators in the recent time, especially after COVID-19, number of deaths are actually identified due to COVID. We have also observed that the healthcare qualities were too bad as compared to even many developing and undeveloped countries context. So, given those backdrop in Indian context, it is quite obvious that if you make the market to be completely free, where anybody can participate and provide health services to the individual or the patient, That way I think it might not be successful enough for the individual patient in Indian context to receive the best one, because the free market is not going to be an idealistic one and may not deal with the challenges faced by the individuals in Indian context. So, we strongly require intervention. So, why I say in market the simple starting motive behind this is actually profit, and market functions well when our assumption of this market is that all the individuals by their standards, by their differences are at a par, or by assumption there should be less inequality or inequity. So, when that is not the case, where in Indian context number of calculations are made where inequality is at the very higher level, especially in healthcare and in social products, social services, the even 10% of the people are capturing 90% of the income. In that case, quite obvious that 90% will be suffering if we make it completely market based. So, Indian products, especially healthcare market, requires government intervention. Also we require in some of the high end services we require market based intervention. So, this is what India is actually following. Therefore, Indian type of healthcare market is actually called mixed market. It is not completely free, not even completely governed by government. So, it is mixed form of market. Whereas, if you look at some of the developed countries like USA, even if you compare with very earlier period as well, the functioning of their market is completely free. Okay. Even in European countries also, though government intervenes in a number of cases, but still their function is largely considered to be free market based, and that has emerged from the ideas of our economist, the father of economists, Adam Smith, who coined the term called laissez-faire economy, who also suggested for less interventions by government. And even earlier JB says etc., if you read those theories a bit, you will see that every supply creates its own demand. Those kind of conceptualizations are made, and hence their economic evaluations or economic functions are actually made largely through capitalist approach. So, those developed countries are to a great extent capitalist based market or free based market, whereas some other countries such as China, largely suggested as a China, considered to be actually a socialistic structure. But I think you might be confused enough with Marxist based approach of dealing with social values. Social values are or the valuations are Marxist based in Chinese setup. But the right interpretation in the present time is actually called socialist approach or welfareist approach, where government takes care of everything. Even it is quite surprising to note that where India requires mostly the value of the government, the role of government in social sector, particularly where we have a mixed method. But those even developed countries are also largely governing the social sector with their government functionings. Okay. So, we will discuss all sort of things in this chapter, like we will identify the difference between capital market, socialist market and mixed market. Largely I have clarified, but for your understanding I just want to read between the lines that capitalist market is basically defined an economic system where private individuals or corporations own and operate most businesses, and market forces determine prices and resource allocation with minimal government interventions. So, that does not mean there is no intervention. In capitalist market also, as I already said, there are also some intervention in social sectors, but the intervention has to be very minimum. And whereas just the reverse is considered to be valid in socialistic structure. In that case, we say that the socialistic or the welfareist market is an economic system where the government plays an active role in regulating industries and in providing social welfare, reducing income inequalities. And the mixed method, which India largely follows, where we have the example of both capitalistic structure as well as socialistic structures. The market and its type in which the economic agents will interact will further depend upon several factors. Again, it is not just the government and versus private who is governing what, it depends on the nature of good those are demanded, its availability of resources, then suggestions by different economies and experiences from different economy in the world, okay, and also the function of our non-government organizations as well. So, moreover, the choice of economic system often reflects a society's values, priorities and historical context. We have given the, some of the examples as I already mentioned. For US we say it is free or capitalist based market. For China and Denmark it is considered to be socialist and welfarist market, and India and Canada considered to be mixed market. There are many other such examples, but defining in a broader context in particular category is very difficult. We need to analyze, and there are different papers who have actually cited, and based on that we are also arguing it. Then after saying where these agents interact, why they interact, we need to understand how they are actually interacting. In order to have a successful market interaction among the economic agents such as individuals, firms, a market should have answers to the following questions: what should be produced, how should it be produced. When I say what should be produced, whether now question is whether it should be necessary goods, necessary comforts, or maybe or luxury kind of goods. Which goods should be actually produced more, and again now whether like when it is governed by market will try to intensify its functioning, and will largely focusing on those type of products where the market might derive the best profit. Therefore, they may not actually deal with the very necessity based requirement in the society. So, we need to understand what products should be produced, and how one can understand, one has to refer different literature, and how should it be produced, which mechanism should be adopted. Again, for whom it should be produced, who are actually the larger contributor to the market. Okay. As we know that the demanders mostly governing in Indian context, in Indian context we should actually propose more for the people who are actually shaping up the market. Once it is produced, it is also obvious to clarify its distribution. So, distribution channels are important, so that it will be actually justifying the products and the need of the society. To answer these fundamental questions of economics, the worldwide markets go through rigorous economic analysis, keeping in view of those limited resources and unlimited ones. In practice, economic analysis establishes facts in the same way as other sciences do, by describing theoretical relationship tested by real world data. So, economics or healthcare as a health economics as a domain, as part of the economics discourses, in that case we have a scientific approach to understand the existing views through theoretical underpinnings, and also we can test with the real life data. Then what is economic analysis? We will clarify all those things, all are discussed in our slides very clearly. You can read on your own. I may not emphasize much, but I am sure that if you read between the lines, you can easily clarify your doubts. There might be questions, questions from each of the slides. Okay, so we will have assignments in every week, as I already mentioned. Those assignments will be actually at least 30 to 40% of the contents will be directly derived from the slides. Therefore, each point covered in the slide should be carefully read. So, economic analysis refers to the systematic examination and evaluation of economic phenomena, often using principles of economics, data models, to better understand how individuals, businesses, societies make decisions related to their resources, production, consumption and their distribution. Those 4 points we have already mentioned, that availability of resources and its production, then who are consuming, how its production is actually distributed to the agents of the economy. That's part of economic analysis, where systematic examination and evaluations are made. Then we will discuss about the decision and choices that refers to the agents, especially the individuals and organizations constantly face involved allocating limited resources such as time, money, labor to meet their wants and needs. So, and regarding production, how resources are actually transferred into finished products and how these products are used and distributed. Coming to other important point which are actually explaining what is called economic analysis, called economic goods. Economic goods we have already started explaining. Once again, are considered valuable, those goods and services which are actually attached with certain value or considered valuable and are limited or scarce relative to society's desires for them. In other words, there is not an unlimited supply of these goods and services to meet all the needs of the society. As a result, people must make choices and about how to allocate their limited resources to obtain these economic goods. You might have read in microeconomics course some of the concept, very important concept called utility. Utility. We read wants. We say choices, we say demand, we say effective demand, then there are some other demand concept like compensated demand, then derived demand, etc. We will be discussing in a later time, but at least simply expression of your satisfaction etc. as part of our society's desires are part of the economic analysis. However, whenever we are defining wants, when we say we have certain wants, it means we have certain capabilities, capabilities for fulfilling some of our utility or our satisfaction level. So, wants are again little focused or restricted. When we have choices, yes, it is a particular selection of your wants. When we say demand, of course, demand is also a broader concept, but it has to with a function of or as a factor of different categories, like different factors should be attributed to explain demand. But when we have say goods demanded or quantity demanded, if anything these type of words are explained somewhere in different literature, different book, you should not be confused much. Basically when we say quantity demanded, we are actually restricting to its relationship to a particular variable. Usually we refer to a price. In this case, when you say choices are quite huge, we need to compare with availability of resources. Therefore, we have to match or match those requirements with the availability and find out the best solution, and these are all part of the discussion of economic good. Okay. Now, I think we have already discussed largely on this issue. However, in short, to understand the fundamentals of economics, especially in healthcare market, okay, economic good we have already explained, healthcare market, we need to clarify with certain examples, the realistic examples, okay, how fundamentals of economic goods in healthcare market is actually dealt and whether it is an economic good or not. So, let us take an example in that case to explain at a micro context, at a micro level how can I understand this is part of healthcare market. An individual who is actually not well or seeking healthcare support. as explained in this picture. The person is saying the person wants medical attention because the person may not be well. Okay. And there are some other individuals who provides that specific health care, who is standing at a different point, and maybe they are the institutions or maybe the providers, healthcare providers. And what is the place of interaction here? Obviously, the place of interaction is the institutions, which I have already said. There may be health facility centers, maybe public healthcare facilities, maybe private healthcare facilities, maybe other facilities, maybe pharmacist, okay, or medical shops, or even quacks. The informal setups in Indian context is hugely present. Informal healthcare setups in different forms. हम सुने हैं what is वो कहते हैं ना कि दादी का नुस्खा, so वो भी काम करता है बहुत strongly. In Indian format, we are emphasizing on what is called traditional forms of healthcare, and which are not documented in literature, but still they are valid and solving many purposes. They are also part of healthcare providers. So broadly we are discussing public hospitals, private hospitals, quacks and others. To explain once again the economics of healthcare, we will be discussing on health seeker and healthcare providers. We will be discussing their interactions through a place called market. Market may be defined through the institutions called public health hospital, private hospital and quacks, etc. So who are the economic agents then? We have already discussed. They are the health seekers, health providers. The healthcare market for interaction we have already discussed. Like suppose we say mohalla clinic, etc. We can also conceptualize them as part of socialist or welfare market framework. When we say private facilities, some of the private facilities like private hospitals, super specialist hospitals, private hospitals, etc. or clinics, they are part of capitalist framework. And quacks, etc. sometimes that is based on profit motive, sometimes non-profit motive. When it is clearly through profit motive, of course we can say a capitalist format. Whenever it is non-profit motive, like some quacks are actually solving the need of the healthcare in our neighborhood, they are not for profit motive, they might be simply termed as socialist approach. So that way quacks can be considered as capitalist format, can be considered as a mixed format as well. So largely literature identify as capitalist format in different context. So we may clarify through reading. So do you remember that in initial discussion we discussed how three types of markets as a platform for interaction between economic agents, but in the last example there are only two types of market. So capitalist or free market we discuss as private facilities. Within that we discuss private hospitals, clinics, pharmacies, etc. Then another type is another broader type of healthcare market is called socialist or welfarist market. When and within that the examples we already discussed, mohalla clinic is a famous example for it. When we combine these two actually together in Indian context, they are actually called, even in international context also, when these two setups are available, called mixed market format. So, so far we discussed the micro perspective of healthcare market. So, everything we discussed till now was actually from micro perspective, as we took the case of a single individual or healthcare provider. So, now on an aggregate level there are large number of health seekers and providers. In fact, there are large number of health seekers and comparatively very small number of health providers in the worldwide or in the globe. Especially if we count down those of the few examples to understand the macro context, WHO actually recommend the standard norm for a better health system to be of one doctor with 100 individuals, or 1:100, one doctor per 1000 individuals, not 100. Okay. So, WHO recommends 1:1000 patients as the standard format for or the ratio to be fulfilled to define as a better health systems. However, for India the reports claims that there are only 0.7 registered doctors per 1000 individuals. as per the latest reference of WHO. So, it is very measurable. We need to actually catch up to that level to define better quality of healthcare. Therefore, we can discuss the difference very clearly between health and healthcare. Our next chapter is actually on this, next lecture is on health and healthcare and its differences. This was said to be increased, that ratio said to be increased as per our Government of India claim, the ratio of doctor to patient ratio increase as per Government of India, Minister of Health and Family Welfare to 2022 document of the Government of India is that there are 834 individuals per one doctor. Those facts suggest that there is actually a strong scarcity of suppliers, especially healthcare provider in Indian context. Even in these are problematic in African countries as well, in some other developing countries. And this means that the healthcare follows the definition of the economic good, as it has the factors associated with economic good that we discussed earlier. Therefore, we define healthcare as an economic good. Now, we will discuss some of the directions to understand this is very carefully. Now, the question may arise whether this is limited to the doctor to patient ratio only, and whether is it the case limited to Indian alone. Of course, it is not only for the Indian context, okay. It is the context valid across the globe. Neither it is limited to the case of doctor patient ratio, nor it is actually limited to the Indian economy alone. Okay. It is equally valid to all the resources used to produce health and healthcare services, such as human resources, capital and raw materials, etc. So, we can list out the factors that make healthcare an economic good. To understand completely or understand the health and economic good, we need to structure all the factors which are also interacting each other to define a holistic approach of health and economic good. So, then what are the factors? So, factors we can count like resources that are used to produce healthcare services, such as human resources, capital and raw materials. Society can devote more of these resources to the production, consumption. Society's wants which are wants for healthcare which have no known bounds. There is no known limit to what we choose to consume, and no healthcare system in the world has achieved levels of spending sufficient to meet all of these clients' wants for healthcare. Are there any implications for health being an economic good? When healthcare is treated as an economic good, it means that it is subject to same economic forces as other goods and services, which is clearly understood. This means that there are choices to be made, what quantity and mix of goods to produce and how to produce it, who pays for it, etc., and how it is distributed, we have already discussed. These choices are difficult indeed. Therefore, we require different permutation combinations, different game theoretic format as well to arrive into a conclusion of dealing with the exact choice function. We require large data sets to handle the choice function and its requirement for the society finally. Therefore, the obvious questions to answer is allocating resources efficiently the best mechanism to allocate resources, and also not just the allocating resources, also to address equity, distributing in a better way, so that the lower end in the society, whoever are in the lower end in the society should actually get more allocation as compared to the upper end. And especially therefore, there are certain poverty alleviation, employment programs, etc., which are targeted for the lower the people who are actually backward. So, more justice is required in this regard for a better allocation. Not just that, we need to take the help of innovation. We want to encourage innovation in healthcare, so that we can develop new treatments that can improve the healthcare. Especially we have realized at the time of COVID-19, the newer method, newer models, the innovative models are actually required, though they are expensive, but may be cost effective. And who should pay for this is an obvious question. So, the other chapters will actually guide you very correctly. Is the healthcare market really similar to other economic good market? Of course, yes, the fundamental answer is yes. However, to state it very clearly that healthcare is an economic good is not to suggest that it is the same as other economic goods and services in every context. If we accept that health is a fundamental commodity, we can analyze the demand for improvements in health in very similar ways to the analysis of demand for other goods and services. But the quality is an important concept here that has to be addressed. There are actually difference between the economic good as compared to healthcare as a good. Health cannot be traded. That is an important aspects to be mentioned. It is not possible to analyze it in the context of a market, since it is not traded. Improvements in health cannot be purchased directly. Instead, the focus is on the production of health as the key means by which people express their demand for it. And as we all know that healthcare products are actually not directly demanded. We are demanding healthcare products is not directly satisfying need. It is therefore we need healthcare products to actually deal with our health standards better. So, healthcare therefore has a derived demand concept from the demand for health. Of course, such analysis can be used for almost any goods and services, but it is particularly important for health because healthcare consumption is usually not in itself pleasurable. Indeed, it is often opposite and it is undertaken simply to improve health. So, some couple of references you may follow. Indeed, I need to emphasize here a considerable part of past and current research in health economics is concerned with the question of whether or not healthcare is different. So, as mentioned by different authors, you can have a read. I think it will be useful for you. Deciding who gets what in healthcare, I think we have to a great extent explained, and what to be produced and how to be produced, the obvious questions to be clarified. Possible ways of deciding who gets what in healthcare, you may please read. I think these are the aspect I should keep it with you for understanding, and these are quite easy for you. Everything is clearly stated. Can the solution work in healthcare market for better allocation, etc.? In some cases it is relevant. For example, in Indian context we need to cite as per the 2020 the private sector plays an important role in most areas of Indian health sector. It holds market share. This is to be mentioned. Out of pocket expenditure is very high, 2/3 of the expenditure is out of pocket, OOP is very high. Even it holds, private sector holds 70% of the market share, hospital beds is of 63%, share of inpatient is of 60%, share of outpatient is 78%, share of doctors is 80%, and then in the references we have given all those link. You can read and understand more on this. Having such a big share means holding many of the health issues. Let us take one such demand of healthcare issue to understand how the invisible hand works as mentioned in our classical approach. So, whether invisible approach is actually working in Indian context or not, those readings will actually help you. So, let the healthcare market be for hyper depression, especially when we are going for some economic modeling and to derive certain solutions to it. Healthcare demand, with an example we can cite for hyper depression in India and many other countries. Mental health treatments like hyper depression treatments are bought and sold in private markets. Based on our definition of healthcare markets for the invisible hand, we have designed the following economic model. So, to say we usually go for demand and supply framework to understand. So how to understand, especially our red is explaining the demand curve for the healthcare in this context, in the context of hyper depression. the slopes downward left to right indicates that the price of treating hyperdepression falls as the demand increases. The reverse is true for supply, the price increases, the supply for those dealing with or treating with hyperdepression rises, therefore it is upward sloping. Okay. So, I have highlighted, therefore, there is a possibility of equilibrium, and the market forces will interact and decide an equilibrium price, and that will be justified to the agents who are actually demanding and supplying both the this product for those different agents. So, this considered to be O to B considered to be as the observed demand, whereas there are number of unobserved demand, but that is actually demanded. This side is actually demanded B to D. So, we can readily observe this effective demand quantity B at price A, that is called observed demand, and there is potential demand actually for this product. However, the market is actually not dealing with other aspects in terms of supply and in demand. So, the price is actually settled at A only. If treatment were free, that is at 0, its demand would have been much higher, that is at point D. Okay. And that is basically D to B, as I said, is actually called unobserved demand. Now, however, in most countries including India and for most healthcare services and products, a complete reliance or unfettered market forces is quite rare. Typically, governments must intervene in healthcare market to a far greater degree than most other economic goods through various ways. Especially what I wanted to mention here is that healthcare needs more attention, government must intervene. I have already clarified in my previous discussion. So, this sector requires regulation, this requires subsidization. Indian government has also started number of packages, number of schemes. Indian government subsidize healthcare either partially or fully funded approach via various schemes such as Ayushman Bharat Digital Mission, under which the National Health Authority issues Ayushman card, which bears up to 5 lakhs of treatment cost and taxes. In some cases they directly provide health as public hospitals, such as example like TB, tuberculosis are fully subsidized, so that nothing is charged at the point of consumption, and the government even provides minimum possible funds for the healthcare. I think we know that it is on a PPP on a center state sharing model in Indian context. In some cases center bears 60%, in other cases center state bears 40% of the expenditure. So, that is why our healthcare is in concurrent list. So, I have already clarified in another context where government provides or take care of everything. Okay. And in specific product which I already said, the supply curve is considered to be rigid and to be fixed. So, and the demand may be following the normal design or normal way which we have already explained. In this case, treating healthcare services as measurable in some comparable units in the horizontal axis, demand curve is same as I already mentioned in the previous diagram. As price is 0, we start with 0 due to government intervention. The demand now will be point D, which I have already mentioned. The supply curve is kept vertical here because government is taking care of the entire amount and allocate a fixed budget for, and that too entire amount, and when a particular or a fixed budget is allocated, then we will start with a particular point B. In this diagram we have said a B. So, irrespective of the demand, but the fixed amount is allocated, therefore, our diagram is perfectly inelastic, supply curve is perfectly inelastic. So, supply is assumed to be fixed at B. We find that without a price system to reconcile supply and demand, demand actually exceeds supply by D to B. D to B, since demand is actually there, but the fixed amount is allocated, therefore, there will be overrush, health system will be overburdened, and like who obtains health services is determined by factors other than price. For example, waiting time list in public hospital is very huge. Some other examples like income group, caste, occupational differences, who becomes the deciding factor to access healthcare in Indian context. One example of such type is Ayushman health insurance card, which is also actually quite a fixed amount is provided. The government intervention based model differs from the market based model in the sense that D to B, the range which I have already mentioned, the observed ones in healthcare should be actually dealt very carefully with higher budget allocation. Okay. So, learning from this example, we have also mentioned that we saw two extreme example. One is in a complete reliance on the private market, wherein another one is in public provisioning of the healthcare facilities. In each case, not everyone who wants health care gets it, and healthcare is actually rationed in another case, either by price or by other mechanism. So, healthcare is, even if in a private structure is rationed, even in another case is also compromised due to other factors which we have cited. In practice, however, most healthcare systems are complex mix of private and public sector activities. So, therefore, some questions might arise: why are government so often involved in healthcare? What is it that makes healthcare special? These questions will be answered with time in upcoming lectures. We will be discussing in our different slides. So far we have discussed about the type of healthcare, health economics, its foundations, basically the fundamentals of health economics. We define health as an economic good. We discuss different types of market for healthcare, and we also discuss discuss how actually in the especially we discuss who are the agents, and where the marketplace, how these are actually dealt. Now, in our next class we will be actually discussing about differentiating health economics and healthcare economics. We will also emphasizing by point wise differences, and what is an interesting and also important point for someone learning from health economics. Health economics is not shorthand for healthcare economics. So, we will be anyway clarifying this. I have read between the lines to emphasize some of the content we have carried. For you, I think the bold one need to be referred. You have to thoroughly read to answer our assignment question or even in the final questions. Other readings are equally important. Our next lecture is actually on distinguishing between economics of health and healthcare. With this, I think it's time to stop. Thank you.